Now, if you listen to the show on any regular basis, you know that the topic of Venezuela, particularly the healthcare situation, is something we've been discussing on the show in bits and pieces. To get a little bit clearer picture, now joining me for a better bird's eye view on the Venezuela healthcare crisis is Dr. Leopoldo Villegas. Dr. Villegas is a senior international health advisor. He's an infectious disease expert and a former advisor to the Venezuelan Ministry of Health. Currently, Dr. Villegas is based out of Washington, D.C. He knows the country well. He studied medicine at the Central University of Venezuela, and he has daily conversations with contacts in the country concerning the state of healthcare. Dr. Villegas, welcome to the show, sir.
Oh, thank you so much for having me.
Excellent. Okay, well, let's give my audience a little bit of a background about your expertise about Venezuela's healthcare over time. Now, you studied there. I imagine you lived there a lot of your life. How long has it been since you lived in Venezuela?
Well, I spent my first 27 years in the country. As you mentioned, I went to the Central University, finished medical school, and then I went to work to the rainforest with the Yanomami communities. And I left the country to do master, diploma, and doctorate in London, and then came back to Venezuela. So I haven't been in the country since August 2011, but I do have almost daily contact with people on the ground for different sectors, from the Ministry of Health, from the National Malaria Control Program, from policymakers. I'm very actively engaged with the country.
Right. And how long has it been since you have had direct involvement in medicine or healthcare in Venezuela?
Well, it depends how you define direct involvement. You know, I have a WhatsApp line with management of malaria cases every day.
Okay, but as far as actually practicing medicine or being an administrator in the health ministry or anything, how long has it been since you did anything like that?
Okay. I left Ministry of Health, I will tell you, in 2005.
Okay, so it's been
2003.
Okay, so it's been a little over a decade.
Yeah.
But you're clearly really involved with what's going on in Venezuela. You have a lot of great contacts there.
Absolutely.
Yeah. So let's go ahead and start with an overview so my audience understands, because I was talking to people at work today about this, and I would say 95% of the people have no idea that Venezuela is going through this crisis right now. So it seems like it's only people that got their ear to the news and really keep track of this stuff. The average person just doesn't really know. So let's go ahead and start with an overview. Can you?
Oh, excellent. Yes. Well, actually, if you look at the news, especially here in the United States, I think the concentration is either of ISIS or is either the political news. So we have, when you look at the international news, you don't see much. I think that the few newspapers are getting a little bit sense right now, and they are putting some news. We got here in Washington, D.C., the attention, and I think today was DEVEX would just put it around and say, listen, guys, infant mortality is worse than Syria. And this is Venezuela, and this is very close here. And so the country has been facing, several shortages of food, medicines. It's just going in unbelievable crisis that nobody can understand how the richest country in South America has become such a horrendous place right now, and so quickly. Nobody have seen this kind of deterioration in countries, not even in a war situation, you see that. So it's something very interesting in terms of, as a case study, how can a country just go down so quickly? So
can you describe the healthcare situation in Venezuela?
Yes. So we have
pre-Chavez.
Okay, pre-Chavez. What we have here is, the health systems have always problems before Chavez. So there were some ups and downs, but it was very clear that between 1995 and 1999, I think there was a bottom investment, very, very low investment of the health systems. And in 1999, when Chavez took power, he had a referendum, they changed the constitution, and they initiated something that they called the missions. So those missions were on health and there were another one on agriculture, etc. But the one on health particularly, Barrio Adentro, the first one was started in 2003. Basically, what they did is they built a parallel health system in which they built 11,000 primary healthcare facilities, or they used, someone else's house to have a kind of service delivery to the communities in a way to increase the access to poor people and communities to health services. They brought a lot of Cuban doctors, medics, and health professionals. And then you have the normal health system with all the problems. You create a new one, and then you start building a massive amount of new infrastructure for the Cuban-run system. A part of those two systems, you have a private-owned clinics, which basically are the ones who are sustaining the health services in the country right now. Everything was fine. Barrio Adentro evolved to Barrio Adentro 1 and 2, but in 2008, there was a very, very low investment. Things start changing. Chavez got sick, and then the investment on health started just rapidly decreasing. At the same time, the government has, the country has been suffering several outbreaks, one after another, before Chavez, during Chavez, and right now, with all the deterioration of the health system and the whole economical crisis and the internal migration, those outbreaks, and we're going to talk a little bit more about that.
Yes.
Those are really worse.
Yeah.
So we have now 3 systems which are not functional, that they are suffering, and they are really, really hit by inflation, by corruption, and the shortage of supplies. I think the shortage of supplies is probably one of the most important issues right now.
Right. Now, but what Chavez brought to Venezuela was hardcore socialism. That wasn't what Venezuela was before 1999.
That's correct.
Yeah. So he comes in there, he nationalizes thousands of industries. But he had the oil supply that was $100 a barrel for years and years.
Exactly.
And
so
you were able to get away with that. And then what happens? The oil drops, the whole system collapses. Is that fair?
Well, actually, you have a country that the country have had more income than Dubai, for example. And when you look at, this is 30 million people in the country. The amount of money that enter into the country is the highest ever in the history. And the government say that they invest a lot, but we already know, and there's some evidence, the United States Treasury and the international corporation, they're looking for laundry money. And there is a lot of activities in the news right now, especially with the national oil companies and some laundry money with Switzerland and other offshore accounts. And this is the biggest corruption ever in the country.
Sure. So here we are in 2016. Chavez is dead. His hand-picked successor, Nicolas Maduro, he's in power and the same system is in place. And we see it, as you described, as pretty much a disaster. Dr. Villegas, if you went back today to Venezuela, would you even recognize the country?
No.
And
that was really good question, because I just sent my wife and my 2 girls. We just went to the country and they arrived a few weeks ago. It's just unbelievable. The whole damage to the society, the morale, the crime rate, the price of groceries and, normal food. People are not able to eat, 3 times a day. Hardly parents, they need to sacrifice themselves and give the food to kids. So they're probably eating once a day, if any food. And there is, with all this shortage, there is a black market. So now people are seeing that more products are coming through the different borders with either Brazil or Colombia, but the prices are based on the price of the dollar, and people are getting money with Bolivar. And the government control the exchange rate. So, for example, today, the government official exchange rate is 650, and the black market rate is 1,385. Whatever you're going to buy on the street is going to be based on the black market price.
Right. And this is exactly what they used to see in the Soviet Union. You would have hardly anything available, but then there would be a black market of, say, Levi's jeans or apples or whatever. But it cost. And that's supply and demand. If there's such a shortage.
Oh, absolutely. For example, I have a talk this morning with one of my colleagues, a physician, professor at the university. His salary is equal to one pot of Nutella. So his salary as a professor in the university in the Central University of Venezuela is equal. Monthly salary is equal to the price of $10 Nutella.
Oh, okay. Well, that's horrible. Okay. Let's go ahead and kind of dig into more of the specifics about the healthcare in Venezuela today. We're seeing lots of media accounts about the hospitals, and we're seeing hearing about shortages of supplies, medical equipment that doesn't work, water that may be running, maybe not. We even hear about gangs going in the hospitals and threatening physicians. What are you hearing about what's going on in the different medical facilities in Venezuela?
Well, I think that we need to know that there are 300 public hospitals. And some of those hospitals were key in the whole Latin America. People from other countries were going to those hospitals. They were reference hospitals in the whole region. Now all of them are really, really, terrible situation. And yes, as you mentioned, the shortage of basic, we're not talking about, having sophisticated diagnosis. We're talking about needles, gauze, syringes. We're talking about the basic supplies for any medical, health facility. They don't have it. And you have problem with air condition. There is a report from the Human Rights Watch recently that was published a couple of weeks ago. And it was very interesting. There is, there is a report from a group of doctors. There is a kind of national residence doctors that make a survey. And there is a 94% of hospitals survey. They have problem with surgical theaters closed, not enough supplies, emergencies and triage being compromised, doctors making the decision in who can survive because they cannot provide basic needs. And we're talking about the essential list of medicines, which is a standard World Health Organization basic package. So we're reaching a state that not even countries like Sudan or Zimbabwe, that they were there in the worst conditions.
Yeah.
Venezuela is even in a worse situation in terms of health.
So if I was a patient in one of the hospitals there and they don't have any supplies, it's essentially up to me as the patient to try to purchase supplies from, the black market.
Exactly. So as a doctor, then you need to get, basically what you do, you just give a prescription to the, any relative to try to find out in different pharmacy. And this is when we call it, this is a crusade. You need to start going in your town, in your city, start calling the family and everybody to go pharmacy by pharmacy to try to find out what the hospital or the health services ask you. And we're talking about antibiotics. We're talking about syringes, gauze, and so many, medicines and basic stuff. We're not talking about complicated. We can talk about cancer and we can talk about non-chronic disease. So this is a different level, but this is just the basic to provide healthcare in the country.
Yeah. Now, I got about 4 minutes left till the break. Dr. Villegas, what is the situation with the physicians in Venezuela or other health professionals? I understand that many of them are leaving the country. Can you verify that?
Oh, absolutely. There is was looking at the numbers today, early in the morning. By 2014, there was already 53% of deficit medical doctors. The numbers are increasing, and people are basically asking for a kind of legalization of their curriculum and their degrees in the National Medical Federation in Caracas, because they basically are moving out of the country. So there is a massive brain drain in the country. We have several countries who have benefit of having all those professionals going. So we have Ecuador, Chile, Paraguay, Spain, Italy, few countries that really basically open and stand in their embassies and start allowing professors and highly trained people to go to those countries. And the last promotion of, at least from the Central University, the last promotion of doctors, 70%, they were agreed, that 70% of them, they were already making plans to go out of the country. Yeah. So there is a massive need. Nurses is a kind of 100% of the time, you always need nurses everywhere around the globe.
Sure.
But doctors, here we're talking about a country who having with enough amount of doctors. The government basically built a parallel system. They train thousands of people in Cuba. Rather than having a doctor who spent 7 years in the medical career, they train people for 3 years, and they're trying to insert them in the country as a doctors. You can't get the same level of preparation. You can't be a surgical doctor if you spend 3 years in Cuba and not even in a hospital. Right. So the insertion of those professionals has been very troublesome. They are part of the system. They are more doing the preventive work. But you need the doctors at the hospital. You need the doctor who need to solve the problem. You need the surgeon. You need the surgeons. This is the first. In the last 3 or 4 years, people are now applying for postgraduate training in key specialties, gynecologists, pediatricians, internal medicine. They're just basically empty. And we're talking about reference hospitals that people were basically dying to trying to get into. And now the positions are just empty. People are trying to get doctors and hire people, but salary constraints, resources to work, there's so many limitations that people rather prefer to go outside the country or just to go and do private clinic.
Yeah. I got about 45 seconds left, Dr. Villegas. If you could answer this question kind of quickly. There's been reports out there that part of the reason that physicians are leaving is that some of them fear for their life, that there's violence threatened against them. Can you verify that?
Oh, absolutely. When you are in a big university, especially Central University, you have the National Central Hospital. The university is protected by their own police security. So no other police should be allowed to enter. So many of the gangsters, what they do is they enter the university because they know that no other police will touch them. And when they are there, they're going to be attending. They're not checking who is who. This is a medical facility. But then, due to the lack of security, the other camps are just coming to the hospital. There has been, there has been doctors and nurses who has been either killed or attacked by other gangs, or patient who has been hospitalized after surgical procedures and they have been killed inside the surgical ward.
Yeah.
So this is happening.
Okay. Well, all right, Dr. Villegas, up against a hard break. I hope you hang in there for the second half. And the website is outbreaknewstoday.com, outbreaknewstoday.com. And after the break, we'll be talking more to Dr. Leopoldo Villegas about what's going on in Venezuela.
Welcome back to Outbreak News This Week, your source for all the news about worms and germs. Here's your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, welcome back to the program. I'm joined today by Dr. Leopoldo Villegas. He's a senior international health advisor and infectious disease expert, and he knows about Venezuela. And that is our topic for today. And we're going over primarily the healthcare crisis that is unfolding before our eyes down in Venezuela. Dr. Villegas, let's try to get more into now the health ministry and some of the outbreaks, the topics that both me and you love very much. Now, the health ministry is not publishing their epidemiology bulletins. It's probably been over a year, maybe longer. So official data is basically absent. Is it fair to say that the Ministry of Health is failing at what they should be doing?
No, I think it's absolutely right. I think it's I would say that people who do not report is because they do not have the system to do it. Otherwise, everybody would everybody wanted to know what is going on, because if you don't know an epidemic, the only way that you will know is when you have people just dropping dead in your facilities.
Go ahead, sir.
So what we have here is, the government decided in October 2014 to stop reporting. The media was taking all the outbreaks. There were several outbreaks. So we have dengue, we have malaria, we have Zika all together at the same time. Then the government decided to stop. So the whole November, December were out completely blind of information. They reinitiated in January 2015. And then in July was the last report. There is no way that you can get information unless you know the people on the ground,
right,
and people who knows that the country has been reporting since 1955 weekly. So there is a report which was the backbone of the health information system in the country, and especially for malaria and for the notificable diseases. This system was built in 1955 and was never, ever interrupted. So this is the first time.
So are you saying this is a political move?
Oh, absolutely. They don't want to hear noise. They don't want the media to make any noise about any death or anything. But, when you have outbreak of this magnitude, you can hide the sun with a finger.
That's right. I agree.
People are going to be dead. People are going to arrive in your emergency rooms, and you can't hide that.
Now, we've seen several outbreaks going on down in Venezuela, and some of them are being particularly hard hit in a place called Bolivar State. Are you familiar with Bolivar State? And can you explain to us, Dr. Villegas, what's unique about Bolivar? What does my audience need to know about this place?
Okay, so Bolivar State is the southern part of the country. It's bordered with Brazil and Guyana. This state is 25% of Venezuelan territory. It's the place when you have the Angel Falls, which is the biggest. It's the world's biggest waterfall.
Right.
It has one of the most beautiful national parks in the world. And they have all those beautiful flat-top mountains called tepuis. But also, it's the place when you have the highest concentration of so many minerals. So we have one of the biggest proven gold reserve in the world. We have coltan, we have aluminum, bauxite, kaolin, and diamonds. So it's an area which is really rich in several minerals. Illegal mining, especially for gold, it has been there for at least 100, 120 years. And this area have what we call the easy gold. This is the gold that you get it on the surface.
Wow.
And the deep deposit is when you have the big amount, the proven reserve, what we call it.
Okay.
So people has basically start getting a few grams of gold, and they survive with that.
Okay, so it's generally a reasonably wealthy place with all these resources.
Well, you need to understand the context then. So if you are a gold miner and the only thing you do is gold mining, you basically get few grams. During that time, you got the money. You spend the money in either alcohol, drugs, and then you are completely broke, and then you start working again on the mining. It's a vicious cycle. People just live there. This is the only way that they know of living. They get some gold, they're broke in a few weeks, and they are back again. Sometimes people just get rich. They get, more than a kilogram of gold or 2-3 kilos in a small group. They got a lot of money. And this money is just out unbelievable. They spend it. They just waste the money. And then they're getting broke and back to the mine.
Yeah. Well, I wanted to give an introduction to Bolivar State because, the once eradicated mosquito-borne infection, malaria, is skyrocketing, particularly in Bolivar State. And we're seeing the highest number of cases in decades. Malaria drugs are in short supply, sometimes none at all. Dr. Villegas, can you tell us what are you hearing on the ground about the malaria epidemic, which is massive right now?
Yes. Well, I think that the first clarification is Venezuela was the first country to declare eradication of malaria, but that was on the northern part of the country. Venezuela eradicates 70% of the malaria in the country. And they remain three foci, what we call the east, the occident, or the occidental, and the south, the meridional, in which Bolivar State it is one of the states. So Bolivar has always malaria, never been clear of malaria. What is the difference is the malaria has been very low, and with all this internal migration, illegal mining, and lack of resources, and very limited implementation of cost-effective intervention, the number of malaria cases started increasing, and for several weeks, the number were increasing to a level that there is an epidemic. There is a shortage of anti-malaria drugs. So people get malaria, and there are different types of malaria. If you get falciparum malaria, this is the most common one. This is the one who is killing kids in Africa and everywhere. When you get falciparum, in 7 days, if you don't get, diagnosed and treatment, very likely you're going to die.
Right.
So all the antimalarials were running out by September 1st. I have been providing technical backstop to different ex-Ministry of Health who are really following the situation. There is, just to give you an idea, there is around 7,000 cases of malaria every week.
That's huge. That is big.
This is huge.
And can you put it in perspective, Dr. Villegas? I mean, I've seen reports right now that are saying that, of course, they're unofficial reports of about 180,000 cases right now. I don't know if you think that's correct or not. Maybe you know a different number.
Yes, I know different numbers.
Okay. Well, what number do you have?
Okay, so I got the number for 2 weeks ago for Bolivar State, the whole state, and this is 186,700. This is only one state.
One state, okay? Right? Okay. So how does that compare to, say, I don't know, 5 years ago?
Okay, you can reduce that by 60%.
Okay, so we're talking, 75,000 cases.
Less.
But less.
In malaria, in malaria, we usually, when we compare malaria progress, we compare malaria with year 2000. This was the year that the whole international community decided to compare. This was the baseline, and then compare every 5 years. Okay,
so it is a big increase, and I've seen some projections where some experts down in Venezuela are saying it could be up to about 350,000 cases by the end of the year.
I think that we're going to go more than that.
Wow.
So I'm following very close with the data. I train people in how to collect data.
Sure.
On the ground in this municipality when the outbreak is there. I still have my house there. And I was the director of a research center for malaria field station there. So basically, people know what they're doing. They know that hiding the information is not the right move. You need to understand your epidemic. You need to move, and you need to act quickly.
Now, we talked about the shortage of malaria drugs. There's a whole bunch of different malaria drugs, but is there any sort of a pharmaceutical industry left in Venezuela, or is the nationalization of all these industries destroyed that?
Well, actually, Venezuela doesn't have a strong pharmaceutical industry. So the country basically imports everything.
Gotcha.
Even the material to make the drugs locally, you need to have the raw material coming from overseas.
I see.
Those companies which has been making products at the country level, especially at the minister, they failed several times to maintain basic productions, following international standards. So the government makes few arrangements with Argentina, Cuba, Uruguay, and China to basically get some medicines and supply directly from those countries. Some of those medicines, we have to say, some of those medicines have no approval by the National Commission for Approval of Medicine Drug, a kind of FDA at the country level. Mm-hmm. But basically, for the pharmaceutical industry, it's a headache. The government control the exchange currency, and they have no access to. So at the beginning, the government say, well, we're going to give you the money. You keep giving us the drugs. And there was a point when the debt with the providers, international providers, were so huge that all the credit lines start to be closed. And every single pharmaceutical company have a huge amount of debt and Venezuela government is not paying them. And it's every single sector, is the aviation, is pharmaceutical industry, food sector, every single production sector they need to get the dollars from the government who is controlling them. So, and even if you get the dollars and you buy the product and you're trying to sell it in the country, you can't sell it to the normal price because the government is having a kind of controlled, subsidized prices. So if you get a medicine for $20, you won't be able to sell it at the country and getting a profit because you might be just authorized to sell it for $5. And that represents a huge bottleneck. Nobody's going to be losing money.
Of course.
With all those headaches just for importation and, all the legalization of products, and then you're going to lose money. So there is a really, really trouble, and it's not getting any better. So we know that the malaria drugs arrived 2 days ago. UNICEF made a donation of 100,000 anti-malaria drugs. This is treatment for kids. So if you divide it by half, this is treatment for 50,000 people. If we have 7,000 people a day, we have a treatment for a week.
Wow.
Okay, so the question is, what is next? And I think that this is what we are trying to explain national, people from the government, people from the malaria community. The country needs 1 year drug supplies. Otherwise, in December, we're going to see a massive amount of death. Why December?
Yes, good question.
Yes, so people will go back to their houses for Christmas and New Year. This is the time when they go back with malaria to an area that they don't know and they haven't seen malaria in ages. There is no treatment in those areas, and they die during that time.
Wow, that is a horrible thing. Now, not only malaria drugs, are there vaccine shortages there also?
Well, absolutely. Venezuela is a member of the Pan American Health Organization. They're having a debt of $40 million with PAHO, which is the Pan American Health Organization.
Right.
Our understanding is that the government gave some money in advance in order to get some credit line. So they got some antimalarials and they got some vaccines. And then we have the diphtheria cases that came out recently. So
yes.
We have another epidemic. And what is interesting is that the epidemics are happening in one place, in one municipality, and then it's spreading to the rest of the country. And the people say, well, but why everything is happening in Sifontes? In Bolivar State, say, well, you need to understand, people don't have money. What you earned in a month's salary, you will spend it in food in a week. So people going to the mine, and we're talking about professional people who got a job. They get vacation or time off. They go to the mine. They can get few grams of gold. And this few grams of gold is equal to probably 6 or 8 months of salary. But then on the way back, they get malaria. Or they get other diseases. So there is a massive migration going to those areas. And in one of the Amerindian communities, Pemon communities, there were few cases of severe coughing, respiratory infections, few death. Few doctors went there and they took the pictures, and then there was a completely blockage of information. Nobody could know what happened. And then they started few death also in reference hospitals in Ciudad Bolivar, which is the capital of the state. And the doctors, the hospital were told, and this is, on the news, were told by the, let's say, health officials not to mention anything because they didn't want anyone to know.
Yeah.
So far they have more than 20 people dead.
Right. Yeah, I saw that. Yeah, and these are the first. These are the first cases that have been reported in I don't know, over 2 decades, right?
Yes, there were 20. The last case was 24
years ago.
20 years ago. So last week they were running out of the diphtheria antitoxins. Nobody is making them because people are trying very hard to vaccinate people.
Right.
And you get the bacteria around the population, and when you have the vaccine to a very high level, people don't get sick. Very few cases isolated. So they got the antitoxin from India. They were running out, and then they imported the rest from Russia. Russia have the biggest diphtheria outbreak a few years ago. So now they have the antitoxins. There is another issue, which is the vaccine itself. So the vaccine is coming from Cuba. It's not pre-qualifying. Nobody knows the quality of the vaccines. Nobody knows really what are they doing, but this is the only thing they're doing. So there basically are massive vaccination going around with all limitations. I have in contact with nurses and people are really, I admire the work of the frontline workers because they are the one who really saving life.
Sure.
They get someone who's giving them a ride, and they go in with a ice pack with the vaccine and go into the community, spend the whole day in the community. Nobody paid them a single, bolivar extra to be there. They don't give them food. And they are the community who basically, offer them some food and water. And then they're trying to find how can they go back to their houses. And that's the people who are making the difference, really.
Yeah. Now, well, it's good to hear that there's some good things happening there with the healthcare situation, these people that you're talking about. However, the people in power, they basically have been treating the diphtheria situation quite a bit differently. They've been denying it. I saw one report where somebody said they're blaming it on the CIA with germ warfare. Well, and that certainly sounds like Fidel Castro to me.
Yeah, well, and you can imagine the person who said that was the previous president of the National Assembly, and publicly on television. So, when you have all these theories of conspiracy, you're basically trying to hide the real problem. And the real problem is that you need to increase the vaccinations. And the vaccination rate, I just got a report a few minutes before the talk and the interview. And basically, the high-risk area, they don't reach more than 55% coverage. You need a minimum of 85%. Yeah. And if you don't cover that, what basically is going to happen is it's going to continue spreading around. So there are now suspected cases in 3 different states plus Caracas. Yeah.
All right. I'm sorry. Go ahead, sir.
So what the whole community is trying to tell the minister is you need to move quickly. You need to involve the communities, but you also need to have the logistic and the support.
Yeah, this is really a life and death situation. Now, there's other infectious disease issues going on in Venezuela. And Dr. Villegas, I have about 5 minutes left in the show. What about Zika? What about microcephaly cases? What do we know what's going on in Venezuela? What do you know?
Well, I was looking at the report from 2015, and the Zika was reported. It was officially reported. There was an outbreak in 2015. The number of microcephalia has been followed by a group of doctors in Caracas who are infectious diseases doctor. There is a network trying to gather the information. The government is not acknowledging anything. They are not recognizing, and basically what they did is chikungunya, Zika, dengue, and any outbreak of anything is just basically completely blocked. We came out with a letter asking for international support independently of the Ministry of Health. I was supporting the 4 ex-Minister of Health, and what we're trying to do is trying to call the attention. Due to the political environment, the situation is going to get worse. What we're talking about here is about death. And when you have this polarized political environment, that polarization will continue, but people are going to continue dying. And the decisions are not going to be made because the decisions are political and they're polarized. So the academia decides to step on and say, you know what, we need to have this one. We need to move on and we need to just support it. And this is the call for the international agencies. But, there is a lot of diplomacy and negotiations and political stuff between, because, the government is the government and trying to go around, no governmental means, if you say yes, that means that politically you are acknowledging the humanitarian crisis.
Yeah. All right. Well, let me go ahead and ask you one last question. And I appreciate your time, Dr. Villegas, for giving me so much time on this a very, very important topic that I really want the listeners to know about. In your viewpoint, where is Venezuela heading? Is it going to get worse before it gets better?
Well, I think if, yesterday there was thousands of people on the street basically asking the government to change the decision, to allow them to go for a referendum and to allow them to have the right of the population based on their constitution. This is definitely on the international radar. The government doesn't want to count votes. The government is a very bad position. Popularity of the president is probably less than 10%. They already lost the National Assembly. They will definitely lose massively any election that they do right now.
Sure.
So what is happening is yesterday there were 140 people in jail, more than 120 people injured, few deaths after the people going on the road, on the street. And today the president announced a 40% increase of salary to try to calm the situation. People are now in a no-go position. So there's not going to be negotiation. People just want to get rid of the president right now. And by November 3rd, the opposition leaders demand the president to either continue with the referendum as it was planning in 2016 or basically resign. So it's going to get worse. And we hope that the situation will not have many people dead. But definitely there is an increase of violence that we have seen. Let's see, but definitely a change is just unavoidable. It's going to happen.
Yeah, it's got to. I mean, the people can only put up with this for so long.
Yeah.
People
definitely want to see something different. This is not the country that we were, 20 years ago.
Right. All right. Well, Dr. Leopoldo Villegas, thank you, sir, for your time and expertise. And, sir, I'll be praying for your country, sir.
Thank you so much.
Have a nice evening. Okay. Well, that was a very heart-wrenching topic. It's really quite a tragedy down there. A once very reasonably prosperous country has gone the way of, like he said, Zimbabwe. I mean, it's really in a lot of trouble, and the violence is starting to start, and the people are not going to take it anymore. So who knows where this is heading? All right. Again, let me remind you that the website is outbreaknewstoday.com, outbreaknewstoday.com. And check out the different headlines on there. We got a Vibrio vulnificus death reported in Pinellas County. It's the 7th fatality in Florida this year. The CDC's up in Flint, Michigan, investigating a Shigella outbreak this time. They've had Legionella. They've had, of course, the lead in the water. Now they're up there checking out a Shigella outbreak. And check out the website again, outbreaknewstoday.com. I want to thank my guest, Dr. Leopoldo Villegas. I want to thank Ace, and I want to thank you for listening. I'll see you next week on Outbreak News This Week. Good night, and God bless.
Thank you for listening to Outbreak News This Week with Robert Harriman. If you missed any part of today's program, you can listen to the podcast anytime on our website, outbreaknewstoday.com. Make sure to join us here next week for Outbreak News This Week with Robert Harriman.